Hello again. We are back to the webinar with Mrs. Gail Devers, 9-time world champion and 3 times Olympic gold medalist. So it's a pleasure and an honor to be with Mrs. Gail Devers today. And I also have the pleasure to be with Mrs. Deborah Bump. She is a nurse practitioner specialized on psychiatric disease. We already had a very informative and very interesting webinar a few hours ago discussing the long odyssey of Mrs. Devers until diagnosis of her Graves' hypothyroidism. She suffered a lot, she was frustrated, nobody was listening to her, and we described actually this odyssey during the previous webinar. The issue today in this second webinar is to dive more into detail, looking at the psychosocial background of the patients during this very difficult time. This was a challenge time for Gail, and we want to know more. And we ask her if we are allowed to ask indiscreet questions, personal questions. Hopefully, we will learn more, and hopefully, Gail is actually comfortable with those questions. So I'll now turn to you, Gail, thanking you again for being with us today, for willing to answer these questions. And my first question is, how do you feel today? How would you describe your quality of life today?
Oh, that's a good question. You know what? I always tell you every day that I'm able to put my feet on the ground and I don't have to wonder or question because I know I can call my doctors. I feel great.
Thank you. So the second question is, your odyssey started 30 years ago, 1988,
Right.
prior to the Olympic Games in Seoul, and you were not able to join to reach the finals.
Right.
So how was your quality of life at that time?
Oh, goodness. Bad. Simple, bad. You know, when that was my job, that was my 9 to 5, that's all I did. And to not be able to do that because my body doesn't feel the same. I don't know what's wrong with my body. Everything's out of whack and nobody can give me answers. Mentally, I was destroyed, to be honest. I keep sticky notes, and I write on the sticky notes my goals, and I sign them, and I place them in several places in my house as a constant reminder to me of what I want to do, and not to be able, and these are realistic goals that I've really researched, so not to be able to accomplish those goals, and that's all I had. It left me feeling like I was on an island by myself.
Did this, let's say, start with the other signs and symptoms of hypothyroidism? Was it actually a simultaneous, occurrence of all signs? You were depressed, you were frustrated. Was it at the same time that you had your heart problems, your weight loss? So was it a combination for you?
It was a combination. You know, it started off as, you know, even for me as an athlete, I was on top of the world, had just broken an American record, and then a short time later, I can't make the final. I'm running slower than I'd run since I started high school. So mentally, that's a problem. I was losing weight during this whole process, so that was stressful. You know, I had what I call like the heart palpitations. I had the headaches. I had, you know, where I'm like tired all the time, but yet I can't sleep. So all this was occurring at the same time, and it was just a lot. Like you said, you asked about the depression. Absolutely. I wanted to just close myself off because I couldn't get answers, and I felt like I knew something was wrong with me.
So you told us that your quality of life was bad.
Mm-hmm.
So let us discuss more in detail what was bad. Were you staying at home only? Were you avoiding socialization or social contact? I heard from you and I learned from you yesterday that you did marry in June 1988.
Yes.
So you were just married, a young lady. You were 22 years old. At this age, you get out, you enjoy life, you travel with your husband, you go dancing, and you were staying at home.
I was staying at home. Yes.
So were you feeling guilty? And how was, let's say, this, how did this impact your marriage and your relationship with your first husband?
It wasn't good. You know, you marry somebody, you date them long enough to get where you feel like you know them. Even from the aspect of, okay, this is what you do for a living, this is what I do. And what I did for a living was I ran. That was my 9-to-5 job. Now, I no longer can do this. So that has on financials, you know, so that's a stressful issue of, you know, having that talk about finances and, you know, what's going to happen with that. And I wasn't the same. You know, I didn't want to go out. I didn't like the way I looked. I could not stand myself. And that's a really hard thing to say about yourself.
Gail, did you feel guilty?
I felt lost. I felt lost. I felt bad that obviously I'm not the person that you married. So I get it.
So your husband was disappointed because you were not able to fill, let's say, the requirement, or what was his expectation when unfortunately you were, or your health was deteriorating?
He wanted me to be the exact same person that he married when he was dating me, and that we would progress together, and it didn't work out that way because I could not. I couldn't give you answers of why I feel like this. I can't give you answers of why my body is changing. I'm eating. I don't have the desire to do anything right now but get answers.
So we are lucky today to have a specialist with us, a nurse practitioner, Mrs. Bump. She is dealing with these problems. Did you had at that time, 30 years ago, professional help?
I did not. I did not.
So, Mrs. Bump, would you be so kind and share your thought with us? How would you actually, if you will now know Mrs. Devers, how would you first start talking to her? Which questions would you ask? And what is for you the most important priority or the most important point to discuss with her?
I'd be talking to the 22-year-old Gail.
Okay.
Okay, because she's still kind of fresh out of adolescence at that point, and I would find out from her what's happening, what's going on in your life, and then we'd have to decide where you wanted to take it. Do you feel like you need psychotherapy? Do you feel like you need to be on medication for a while? Do you need both? And that's how I would approach it. I always kind of figure out what's happening at this point in your life.
Right.
Yeah.
Thank you so much. If I'm allowed, well, this is what I said at the start, I would like to dive a little bit more in your psychosocial background.
Okay.
Please feel free to either answer or tell me no, this is indiscreet.
Anything's open.
So, Gail, how was your childhood? How was your adolescence? Were you happy? My understanding, you grew up in San Diego, Southern California. Your father was a pastor. So how was your adolescence and childhood? You were happy? You were lucky?
I always tell people there was a show called Leave It to Beaver. We were Leave It to Devers. We grew up, you know, family. We had dinner together every night. You know, my mom and my dad both took on both roles, you know, where one night my dad would cook, next night my mom, and then we took on the roles of they're teaching us how to prepare. So the kitchen was mine one day, one time it was my brother's. We were, you know, we went to church, We learn to, you've got God, you've got prayer, you've got, that's your best friend. And I say I grew up the all-American child.
Great to hear. Were you put, let's say, indirectly under pressure at school or in the family? For example, were your parents, hoping that you would be a champion or excellent at school? Were there any requirement, direct or indirect?
No, you know what? I follow the same rule, I guess, with my own kids that my parents did with me, and it was always to just do your best. That's all you can do. As far as athletics, they didn't know I was going to run at all. I will say I never missed a day of school from the time I was in kindergarten to, and that's because I wasn't sick. I didn't have any issues, so that wasn't something they said that, your job is to go to school, but my brother missed school because he had chicken pox, and I had mine during the summertime, so I never had those issues or whatever. But it was just to do your best. I didn't start running until I got to high school, which is considered late, so they didn't have expectations there.
So you would say I was happy and healthy.
Yes, absolutely.
Until May 88?
Yeah, until I wasn't.
So it started suddenly?
As I look back at pictures, like from 87, I could see different things like with my face that I probably didn't notice at that time. It was no big deal. It was like, okay, well, my face has always been like my skin has been sensitive or whatever. But yeah, and I believe in 1988 was when, for me, I noticed that I was on top of the world and somebody took the world away.
And for you, what was the reason for the psychological changes? I mean, you were telling me quality of life changed a lot. I was unhappy. So for you, what were the main reasons? Could you describe this? Any concrete factors, any concrete signs explaining your bad quality of life?
Bad quality of life is that I can't do the things that I want to do. I was able one day to get up and do everything that I hope. I write down my goals, my dreams, and those are the aspirations. I know that it's not going to come easy. I've always known that. I have long range, short range, mid range goals or whatever. So it's not that I'm looking for something to be easy, but I'm looking that the frustration part for me and the quality became, I can't do it. I've got the will, but my body is not working with me. And I want answers. I was talking to you earlier, and I was telling you that you have, in the United States, there was 30 years ago, you write to Dear Abby to ask for answers. And I call myself Dear Abby, but the difference with this Dear Abby was this Dear Abby didn't have any answers. You can write me all day and I'm gonna write you back, don't know, because that's what I was getting. And that was frustrating for me.
Okay, so you were, let's say you were a runner, you were running, hurdle.
Right.
Hurdle, 110 meters hurdle?
100-meter hurdles, yes.
Yes, so this is a tough sport.
Right.
And I presume you are not the only sport woman or
No.
lady running. So those who were not successful had the same problem you had?
Well, now there's a difference. You can get out there. Now, I was very cognizant of knowing that just because I set a goal for myself of what I want to run or what I want to do doesn't mean it's going to happen. But there were extenuating circumstances in my opinion that I ran 12.61 May of 1988. 6 weeks later, I'm running 13s and I'm stuck in the high 13s. There's a problem. I may get a good day and run a little faster, but then I'm like dead dog tired, can't come back, can't compete the next day, can't function. That doesn't make sense.
You don't have psychological help when you are in a team? You don't, did you talk to, let's say, expert when you were doing sport?
Well, we have, even when you make the teams, we have a psychiatrist, psychologist, we have people that you can talk to, and we did. Because they're always on the mental side of it. On athletics, they're like, athletics is more mental than anything. So we did have people that we talked to, but even they're not gonna look at you and say, or they didn't look at me and say, there's something wrong with you. physically. It's more, where's your mind? You got to stay in the game. So it was more trying to teach you to take it how it comes, to don't stress out, work hard, tone everything else out. It wasn't, but that's not what I was feeling. I wasn't feeling the athletic side of it. I was feeling the internal side of Gail, that this is not Gail. This is not me.
So you were looking for answers.
I was.
And you were frustrated, psychologically frustrated, and I would like to have the opinion of Mrs. Bump. So who was helping you? Were you did you have the opportunity to have professional help or private help? Husband, mother, father, and Mrs. Bump, what is very important in such a situation? Would you say the private help is more important than the professional help? First private, then professional? Or would you say no, we as pro should actually take care about this problem?
When you say private help, you mean the family?
Familiar,
Yeah,
family,
okay.
exactly.
Yes, the family help is very important. Sometimes it makes the difference whether a person goes on to recover, because they're there.
Right.
They're with you. You're at home with them. It's mother, father, brother. They all love you. They have a vested interest in you, and they want to make sure you're okay. Yeah. So
Thank you
that's
so
important.
much. This is very important. So, for your information, Gail, I see 1,000 patients a year with autoimmune disease. So your disease, I see 1,000 patients. And without exaggerating, 50%, 50, need psychological help because they have sometimes the same problem, the same delay of diagnosis. They are not considered, or their complaints are not taken seriously. Many patients have problems with their partner, male or females. Many have divorces or are left alone. So back again to your private or familiar health. We talked about your marriage.
Right.
So were you able to talk to your husband, to your first husband? Was he listening? Was he helping you? It is somehow indiscreet to ask, well, how, let's say, close you were together. I mean, you were married, but you may be married and still be, let's say, not very close together.
Right.
I'm not telling you anything new.
No, because it becomes a disconnect. I think for us, either I wasn't expressing exactly how I feel, and I just need time. I need somebody just support me, and I wasn't getting that. And it's no blame, because I understand. I mean, I try to walk in somebody else's shoes, and if I were him, and this is the person that I married now, hopefully I'd be very supportive and say, I don't understand what you're going through, but we're going to go through this together. But everybody can't do that. Everything changes for this person when it becomes finances. And now who's going to take care of this? And this is what I thought was going to be coming in, and now, but even that is no guarantee, and that's what I tried to explain. So it just didn't work. But on the other side of that, once that was gone and there was that disconnect where I just can't do this anymore, my mom, my dad, my brother, my friends were there for me. And they did, my coach, my teammates did come and say, look, we don't know what you're going through, but we're here if you need us.
So Gail, this is good news. So you are telling me my family took care of me?
They did.
My mother, my father, because you told us at the start, well, I had a beautiful childhood. We were having dinner always together. We went to the church. Was the religion aspect important to you, to be a believer? Was, let's say, the religion a help in those challenges or in those difficult times?
Absolutely. I say my faith,
Your
and my
faith?
faith and belief that I'm not going to question what's going on with me or why. We were taught not to, you don't question. Now, I don't know what this is, and so I'm not going to question it, but I do have faith that everything happens for a reason. And eventually, if I just keep pushing, like my mom used to say, push, which means pray until something happens, eventually that answer is going to come. And it may not be clear to me on why it's happening to me at this particular time, but he doesn't give you more than you can bear.
Okay. So you mentioned twice the word finances. So let me understand, how was the situation at that time 30 years ago? I mean, you were running. So who paid actually your activities? Did you receive money from the government? Was your husband paying, if I may? And was this financial problem a big problem, having an impact on your quality of life?
Oh, absolutely. You know, he had a job, so he had his, but I was coming out of college, and you have your contracts where you sign a contract, you know, you make the Olympic Games, you have shoe contracts, you have different things. If you don't run the way you're supposed to or where you're supposed to, they can reduce your contract. I hadn't even got to that point because I got sick right afterwards, and so we were supposed to renegotiate and do different things. So the money that should have been coming in was not able to come in because I didn't even make the finals, first of all. And now I got to find something else to do, but this is what I do. So I even tried to figure out, well, I always wanted to be a teacher too. So let me go in and go back and try to get credentials to teach, you know.
So you were running out of money, if I may say.
Yeah, it was hard. You're living, as they say, from paycheck to paycheck.
And your husband was also doing sport?
No, he was working. He was
working.
He was working.
Okay.
But for him, that's not the lifestyle that he's signed up for, as so to speak. You know, he was going to be there for me, and now I'm not doing what, like, you know, that was a conversation that we had. There were some tough conversations that we had to have, you know, as far as this is not what I signed up for. And I got it. I understood, and I don't blame him. You know, it was best that we parted ways, unfortunately. I didn't want to be a statistic, but there I was.
So what we are offering at my institution, we call it couple treatment or couple therapy, because many patients are left alone. So we are trying to motivate the partner and explain the disease to the partner, female, male.
Makes sense.
So is this feasible in the United States? You as nurse practitioner, is this helpful for you if you are involving the partner when the patient has this problem?
Yeah.
Mrs. Bump?
Yes, it is important to involve the spouse. But some spouses have made up their mind that despite the therapy, that they don't have the wherewithal to be in a relationship with a chronically ill individual.
And what is your experience, Mrs. Bump? Is it, let's say, a social problem? Does the husband or the wife is embarrassed to have a sick partner? Or is cosmesis playing a role? Or is a financial problem that she is not gaining money? Which factors impact or lead to deterioration of the marriage, in your experience?
It's a multitude. It's no one thing. It depends upon the family. Some families are very wealthy, but still the spouse does not want to deal with a chronically ill individual. As Gail said, you know,
And you
that's
get
not
tired
what
of
I signed
arguing.
up for.
You know, you get tired of arguing about the same thing. You don't have answers, so I can't tell you, yes, I've gone to the doctor. You see me going to the doctor. I don't have answers for you. I don't know what's wrong with me. Maybe this is, and I did. Maybe this was my new set of normal. Maybe this is what I'm supposed to do. And what I thought was supposed to happen is not going to happen.
Was it hurting for you that your husband did not, let's say, well, help you or did go to the physician trying to embrace you, to help you survive in a psychological manner?
I think even in the end, it got to the point where I don't want anybody, I don't want him to go. I just don't want it. If it's, you know, negativity is negativity, and if you don't understand, and I don't want to force you to go. I don't want it to be like you have to go with me. I can go by myself. I'm very independent. That's not the issue. You get tired of fighting and talking about it, because that became more stressful than anything else, because I don't have answers. And anyone who came at me was asking for answers. I don't have them. I don't know what to tell you.
So how open were you with your friends, with your family? Were you telling them the whole story, your private problems, your health problems, your palpitation, weight loss? Were you an open book?
I was. I'll tell anybody who asked, because I was looking for answers. But then it got to the point where even some people that I knew that maybe hadn't seen me in a while or whatever, either they didn't know what to say, because sometimes after, it was 2.5 years before I was diagnosed. So in the end, I looked quite a bit different than what I looked like before. And they would even come up to me and either not say anything, but give me that look like, oh, wow. Or they'd even ask, what's wrong? Are you anorexic? Are you on drugs? And if you're my friend, I think you know me. I've never had a smoke or a drink, so that shouldn't be your question to me, but it was.
Gail, do you think your friends, could you differentiate between real friends? I mean, you may have colleagues, but friends is a person who is helping you when you are in a bad situation. This is real friendship.
Oh, yeah.
So were you lucky to have many friends helping you, embracing you, helping you to survive psychologically, physically?
I prayed for discernment, and eventually what I said is I have associates. Associates are people that I see once in a while who don't really know me. I could name on 2 hands my friends that were there for me, and they're still there for me. That was the difference.
In those situations, the number of so-called friends is limited, or becomes, unfortunately.
Yes, it does.
Mrs. Bump, she was frustrated. Her husband was not helping her. What would you recommend in those situations? So Gail is coming to you, learning that you are an expert person, that you are able to help her. So would you automatically give her pills? Would you try to do a psychotherapy? What would be the first step, the second one, and how long will you manage her?
Usually in a situation like that, what I would do is likely find out what she wants to do. And the gold standard would be medication and therapy, but everybody doesn't need medication. So when we talk about, and I think that yours was probably more situational at that point, and I think it was important for you to talk to somebody, to work it through. Now if you decided, you know what, I think I'm still a little depressed, you need something, you could have something for the short term. It doesn't sound like you needed to be on any kind of medication for years and years. It may 6 months to a year until you got stable and got out of that situation. Yeah.
And I would say yes, I probably needed, and like you're asking me my choice would have been to be able to talk to somebody who would listen.
Yeah.
Not just on the medical side, but on the mental side, and help me work through that.
Are you crying again?
I think for me, like you asked the tears, it's because when, like I said, I walk in other people's shoes. I want people to do the same for me. And walking in my shoes is to understand. You may not totally understand, but to have empathy and to help me figure out why my life was turned upside down and how to write it back the other way, or figure out my new path of normal. And that's all I was looking for.
Thank you, Mrs. Bump, and thank you, Gail. We understand that the situation was very difficult for you. So What did you do? Your husband was not there for you. So how did you manage during this difficult time, 2.5 years? What did you do every day?
I was just there. And, I wasn't there for him either, because eventually I turned off. I tuned out. I'm like, I got to take care of me. I can't be concerned about you and your issues right now. I've got to figure me out. I said, okay, let me figure out. I wrote a resignation letter to my coach and said, hey, you've got all these world-class athletes out here, and I think I'm taking up your time. Let me find something else. Thankfully, he wouldn't accept it. But I wasn't training because I was, my body was, I was losing my muscle tone, so I was pulling my hamstrings, so I couldn't train. So I was more in therapy than anything as far as physical therapy. I went back to school, and I was taking courses that I could take at home to start teaching. Because I'm like, okay, that's the other thing I always wanted to do, was I wanted to be a teacher. So I was trying to find other outlets. And when I wasn't doing that, and I wasn't going out of the house, I'll be honest with you, because every time I went out, somebody would ask me a question that I don't have an answer to. Other than, yes, I've gone to the doctor. What does the doctor say? The doctor said there's nothing wrong. So what are you going to do? I'm going to go to another doctor. So I stopped going out so that I wouldn't have to answer those questions. I sat at home, I watched I Love Lucy, which for me is comedy relief. There is a moral in her story. She's not just all crazy, but there is a moral to every story, but it gave me laughter. And that was the only joy that I was finding during that time.
Thank you. So you were alone at home?
I was alone. My parents still lived in San Diego. I lived in Los Angeles, or the outskirts of Los Angeles, Palmdale, and they would come up and visit me what they could, talking on the phone. But sometimes you don't even want to talk on the phone, because talking on the phone, my dad would write me a letter and just say, I love you. And that's all I needed. My mom would call, check on me. This was 30 years ago, so I didn't grow up with a silver spoon in my mouth either from my parents. So even to make phone calls, as far as like long distance calls, it charges you.
And nobody had the idea to offer you psychological help?
I don't think anybody knew what was really going on with me. My coach, they would come check on me because they were closer, distance-wise. But when you want to be left alone, you want to be left alone. And regardless of what people are going to say to you, if you're not willing to, and that wasn't even an option. I don't even think anybody asked me that at the time. They were just trying to figure out how come I couldn't get back on the track. Why couldn't I run?
So you were staying at home,
I was staying
alone? Your husband was gone?
He was gone at that time, yes.
He was
we had
gone?
separated, yeah.
You were alone, and what were you doing the whole day?
I was in a dark house. I had covered up my blinds, because the last time I looked myself in the mirror, that was not the skeletal of the person that I remember. That wasn't Gail Devers. I wanted to catch up to Gail Devers. I write my goals. I placed them around my house. And at this time, they were on my walls. I even covered those up. I went to a fabric store and I bought fabric that was black. And I covered the mirrors. I covered the windows. And I did not want to see anybody on the outside, and didn't want anybody to see me.
So you were living in the dark?
I was living in the dark, absolutely.
Had sleeping problems?
I did not sleep. That's why I watched Lucy all the time. She was on television, and I watched her because I'd be so tired and I want to lay down. As soon as I lay down, I'm up. I had jitters, I had heart palpitations, I had headaches that I always said nothing could help me but a dark room and a prayer. And so many things. I had menstrual cycle issues that, can't go out. I'm like bleeding all over the place. So I sat on the toilet, and I had, in addition to my regular cycle, I also had a lot of blood clots that would just run out, and I just sit there. I'm just sitting there. I did crossword and word search, and I played solitaire. I was the solitaire champion during this time.
How did this difficult time change actually your life? Did you become harder, tougher, or so how did you cope with this miserable time?
That's a good question. I think I did become, I always consider myself the nicest person in the world until you get on my bad side. So the world had got on my bad side because I didn't have answers. And I think as far as becoming harder, I was frustrated. And I probably blew up at people quicker than most, and I didn't want to do that, so I stopped talking to people. I will say when I did come back, that isolation had something to do with, you know what? I don't know what the word no means anymore. You can't tell me no, it's not in my vocabulary. And I took on a different persona as far as, you know what, if I put my mind to it, because for so long I thought I was crazy. I really thought I was crazy because I was being told there's nothing wrong. And it wasn't like I was asking my mom, I was asking the medical profession, and they were coming back telling me there's nothing wrong. And I felt that nobody was hearing me, that I know my body better than this doctor that I may see once or twice a year. I'm coming to you asking me, I don't have that background. I didn't go to school for this. I'm putting my trust and my faith in you. My career is on the line. There are people who have Graves' disease, but they can still go to their 9 to 5. They may be tired, but they're sitting at a desk. I can't do my job.
Gail, you were alone in the dark. Did you had actually suicide?
Oh no, I love myself too much.
Yeah.
I just wanted answers, and I just didn't want to have to answer to anybody else.
So you were depressed.
I was depressed. I felt like my example is that if I was in a box and they have block parties, they had a box party, and everybody came and sat on this box, and I was inside and they weren't going to let me out. And I'm pushing and pushing and trying to get out, and nobody's letting me out. The difference was the one day, because I was thinking of the doctor saying, you know, it's all in your head. I'm like, it's not in my head. But okay, at a certain point, I was believing that it was in my head until this one day that I was just sitting at the house. And I said, I might be making up the way I feel, but I'm not making up the way I look. I was sitting there going through my picture books and looking at pictures from UCLA days, which was in May of 1988 when I had broken the American record. So there's all kinds of pictures and newspaper clippings that people would send. That's not me. I don't even know who she is. And people always laugh because I still kind of talk in third person because that was her. And then there was the other her that was sick. And it was that day of me looking at those pictures that I made a decision. This is not me and this is not my life, and I'm not going for it anymore. I don't care what anybody says. They don't know me. And I'm going to keep pushing until somebody gives me an answer. And that the theory of that box that I was talking about was when you open a box and you close it back, it never closes back the same way when you try to tape it. So there was a silver lining.
So what do you think? Who gives you this strength? Was it your faith?
That's my faith. That's my faith that I'm not going to be denied. I got tired of having a pity party, which is what I was having. I was in my house having a pity party, and I'm like, party's over, gotta go.
And you just told us that you avoided getting out, that you were isolated at home. Nobody came and visited you?
Oh, they would visit, but I wouldn't let them in. Like, you can come all you want.
So
Just call me,
close
ask
the door,
me.
and
I mean, I'm a to myself person, you know, they would come. And Bobby's like, I'm not going away until you open the door. Okay. I open the door, I open it, here I am, I'm fine, bye-bye.
yeah, but I mean, it was clear that you had psychological problems, that you were unlucky, and nobody offered psychological help.
No, you know what?
Professional help.
The only places that I went, I get in the car and I drive down to San Diego to visit my parents because they're not going to judge me. And when I lived in you know, the LA area, and so now my husband, his family, I was always close to his family, his sister, my best friend, and they didn't have any kids at the house anymore, and I would go and visit his parents because they would just love me for me. They wouldn't care. I'd go over and his mom was like, oh, she didn't say anything. She saw that I was losing weight and she's like, oh, I just made a pot of spaghetti with corn. I'm like, I never had spaghetti with corn. But I would eat, you know, and we just sit there and talk, or they'd sit there and watch TV. The dad played Miss Pac-Man. I sit there and play Miss Pac-Man with him, and they didn't judge me. And the one day, I always tried to leave before I thought anybody would come, and I thought I was out of the house. I was walking out, and in comes Mike and Chris, which was my best friend's brother and her boyfriend at the time. And it was like an intervention. That's how I felt. And it was only recently that he just asked me, was that offensive the way that he asked me today, to be honest.
Right.
Now, we've been married forever, and he just now asked me, I always wanted to ask you, was that offensive the way I approached you? And it wasn't. I mean, they came and they were like, whoa, you know, he was back home from school or something like that, and he looked at me and he was like, "What's going on with you?" And they pushed me back in the house. I mean, I was literally walking out the door. They pushed me back in the house, made me sit down, and they sat there and they're like asking me questions. And I didn't feel threatened, but I'm like, oh my gosh, stop asking me that. You're going to ask me the same questions. But I knew theirs came from a place of love. So I answered their questions. Yes, I've gone to the doctor. No, there's nothing wrong. They keep telling me there's nothing wrong. They're like, then you have to keep going because there is something wrong. I said, I'm going. I've been going, and I make doctor's appointments whenever I can, on a regular. And they're like, well, what can we do? And I think even that, they're like, you have to keep going. I think even that was that extra push of, you know what, I'm not going to stop until I get an answer.
Thank you, Gail. Thank you. Mrs. Bump, what do you think? I mean, she had really terrible time. And of course, we know that she had Graves' hypothyroidism, thyrotoxicosis. Was it for you the only reason for her depression, for her bad time? Or would you say, I would like to dive more and see if other reasons for this depressive mood could be detected? What would you do as a professional?
What, other than her illness at that time?
Exactly.
I'd ask her, did she have a history of depression? Because sometimes things can kind of mesh, and so I would ask you, is there history, not only of depression with you, but is there a familiar history of depression as well?
Right,
Yeah.
and my answer would be no. I mean, I was that person that I find something positive in the worst situations, and I was trying. And it was just piling on top of each other till I felt like I was drowning.
Yeah.
And it wasn't until I really stopped and took, a second, third, and fourth look at myself before I was like, nope, this is not me. I'm going to crawl out of this. And I'm going to find the strength in me. I don't care how deep I have to reach. It's in me. And I'm not going to be stopped.
Mrs. Bump, are you facing those conditions also in your daily life, in your professional life? Ladies with metabolic problems, having psychological depressions. Is this your experience?
But some of it. I do have patients who have psychotic disorders, like schizophrenia, and mood disorders like bipolar, and so bipolar disorder, and they're on a variety of medications, and it can cause what we call a metabolic syndrome, where they're gaining weight. Sometimes their hair is falling out. Their cholesterol levels are going up. And they're depressed, and a lot of them say, well, I don't want to take this medication anymore. But the alternative is, if you don't take the medication, you may wind up in the hospital. So it's not so much my depressive patients, it's more of my patients who have schizophrenia or bipolar disorder.
Okay, so do you think that medication will speed the healing process?
For depression, it could.
Yeah. It could.
It could.
Now, we were talking in the previous webinar on patients' organization. Of course, patients' organization, you are talking about medicine, about investigation, about diagnosis, blood drawing, and so on. Are you in a patient's organization? If yes, are you talking about psychological problem, depression, depressive mood, anxiety, with other patients?
Yes.
Are you
it's real.
open?
I am an open book. It's because it's real. And if we don't talk about it, we won't make changes. I imagine how many people felt like I felt or feel like I feel with no answers, and either they're too embarrassed to go and get help, or it's not readily available for them because we talked about finances. So in order to have medical profession, you got to pay. So there's always that dilemma too. And so if you can get into a community, and we're not trying to diagnose you, we're just trying to tell you that you're not on an island by yourself. There are organizations, or let's help find organizations or people that will help you.
And the other patients are also receptive and open for such a discussion, Are they openly admitting that they have psychological problems, that they need help?
Oh, it's amazing when you find somebody who's going through what you've been through or what
Yeah.
you're going through, that they'll open up. That they're like, oh my gosh, I thought it was just me and I didn't want to say anything, but I'm so glad that you're saying. That's why we know that there is a need. There is a need for you. There's a need for people to be able to talk to you and you help them figure out and navigate medicine, talking through however, therapy itself. There's a great need, and it's in addition to being diagnosed with a disease.
Gail, in those patients' organization, or you're talking about community, do you have counsel or consultant nurse practitioners or physician being present, talking with you or with other patients on these conditions?
Well, that's the thing. It's trying to get that community together because everybody understands, whether they do it through a group chat, that there's a need, and figuring out and finding people who will align themselves with us and organize this and make it happen because they care about the person more than the dollar.
I told you that I see 1,000 patients a year with your conditions. We always offer multidisciplinary consulting, or how do you say, online meetings. We are also having presence meeting. And we always invite psychologists, psychotherapists, specialists in psychosomatic medicine. So these specialists explain the situation to those patients with autoimmune diseases. And there is a close correlation or close association between autoimmune disorders and psychological disorders. We see many patients with depression, depressive mood, anxiety, with type 1 diabetes, Graves' disease, Hashimoto, thyroiditis, rheumatoid arthritis, and so on. So this is our daily bread, to offer multidisciplinary management, not only medical treatment for the thyroid, but also psychological help and other specialties. And I think this is a must.
Yeah.
And I have done actually such meetings, or have, let's say, attended such meetings here in the United States. And many specialists are offering now these, let's say, consulting events. Now, let's look a little bit to the future. And you are lucky married and you have 2 children.
I do.
And I congratulate you. Fantastic family. I met your daughters yesterday. Beautiful young ladies.
Thank you.
Beautiful. And your husband is a fantastic person. Congratulations.
Thank you.
How are you explaining your, let's say, your odyssey and your difficult time to your 2 girls? Did they ask about it? Did they heard about it? Or were you active and did you explain your difficult time spontaneously?
I think it all happened probably together, because even when they were younger, I take medication every day for the rest of my life. And so they see me and they're like, what are you taking? Can I have that? No, you cannot. And explaining why I'm taking medicine. And then because I'm a public figure, in school, they read, they see, and letting them know, I had that hard talk that I have Graves' disease, but also because from the time they were born, they've had testing on a regular, just to make sure, I hopefully can combat that. So they know all that I've gone through. They've listened to my story. They come with me when I go and I speak. And even for them, when we were talking yesterday, I don't look at them because they're like, okay, it's hard for them. They're my kids. And it's hard for them to know all that I went through. They know about my marriage. They know about everything. I am an open book, for real. They're like, okay, we don't need to know all that. Yeah, you do. But I want to tell them. I don't want you to hear it or assume that you know. If you have any questions, I should be your first person that you come, because I care for you and I love you and I want to help you not have to go through some of the things I went through. Like I said, my youngest, we've had her tested. She does have the antibodies, and so she's at a higher risk, knowing some of the things to look for, and I don't want her to go through anything that I've gone through. So if there's education, communities, you know, that we can put together now so kids don't have to suffer that, I'm all for that.
You are a national hero, and you were an Olympic champion. So what does the government do actually to educate sport people in the United States?
To educate as far as
Well,
about what?
to
About-
detect such conditions
Oh.
and not wait for 2.5 years.
I think that's a work in progress, to be honest. You know, there are other athletes that their coaches have reached out to me because some of their athletes around the world have been having some issues, and I try to be there to help mentor them. You know, they're not from the United States, so just trying to find out what do they have access to where they live, you know, and just, you know, I always tell them, you're going through insomnia, call me because I'm usually up too, you know, and just to be that shoulder to lean on. I just think as far as what's being done, not enough, not enough. And it takes situations like this, people getting together with a common goal to make a difference. And I want to be that voice. I don't want anyone to have to go through what I went through, because you deserve that quality of life, and you only have one life to live. And we got to figure out how to alleviate the suffering, how to make it quicker that you get under a doctor's care so that you don't go through depression. You know, thankfully, I think through my faith, I was able to go through to the bottom, because I was at rock bottom. No, there was not a time that I ever wanted to leave this world. I just wanted answers. But there are other people that I feel they may not have that, and they may be at that point. I got to do something about that.
Mrs. Bump, you as a professional nurse practitioner, would you propose to follow in a regular manner Mrs. Devers, if she would allow this, if she is willing to, let's say, to have those regular meetings? Will this be helpful, or is it not necessary, or would you recommend this as a long-term follow-up?
It can help, but I don't think it's always necessary. Sometimes people will go to a therapist when they need to go. If she felt like she was going through some crisis at that point and she needed to talk to me, then certainly I would talk with her. But she doesn't have to, it doesn't necessarily have to be on a regular basis. She could check in when she needs to.
Gail, I admire your courage. I admire how open you are talking about your difficult times. We are sitting here with you, a specialist nurse practitioner, doing an excellent job, a pro. I'm dealing with patients like you every day. In my experience, I see the patients for years because they have autoimmune disease, so I recommend to follow them, both medically, sometimes also psychologically, because difficult times can occur again during menopauses, or if you have financial problems or private problems and so on. Would you say, without being indiscreet, this would be good if you could, for example, have a regular help from such a wonderful lady sitting on your left side?
Absolutely.
And meeting her, let's say, in a regular manner, and just talking, because a pro will discuss with you another level. We'll talk, we'll ask professional questions.
Right.
We learn how to ask questions without hurting you, because questions can be indiscreet, can be hurting. And it is a science. It's a professional life or a profession to ask questions, pull informations without hurting the psychological aspect or health of the patients.
Yeah.
So my question to you, dear Gail, do you think such a help is further recommended for you?
I think
Are you
it's
feeling
necessary.
stable enough?
I mean, I feel stable, but like you said, life is ever changing. And there's always things that could come up. And so if somebody can help you and make sure that you stay on that right path, you know, where you don't feel like you have to go back and retreat. I will never go back into that dark house again. I will never be put back in that box ever again, regardless of what happens. I think for me, what put me in the box was me listening to people tell me that it's in your head. That, and then compiled with that was a marriage that didn't work, was a, trying to figure out what I was going to do with my life, and thinking that I was crazy, because that's what I thought. And then finding out that, oh, it took a long time, but no, there was really something wrong with you. That was a aha moment for me. The light bulb came on. It was like, no, thank you. Thank you. Now I have all the tools that I need to go and catch up to Gail. I can go and find her, but I do know now, going through and if I had known back then what I know now, I would have reached out to you then, and we would have been best buddies, because we would have just been hanging out, not just even in a professional setting. It's like, let's go hang out, because if you see something, you're going to say something, And so it is important to make sure that, all my best friends now are doctors. So, and it's to make sure that I don't have to go back there. I don't feel like I will. I feel like, but you never know what goes on in life, I do know that if I need to reach out to somebody, that I can.
Thank you so much. Mrs. Bump, we know, it's fantastic as Gail has so many friends, also as physician, but friends are sometimes asking, let's say, not the wrong questions, but they are having other discussions. Would you propose to follow in a regular manner Mrs. Devers, if she would allow this, if she is willing to, let's say, to have those regular meetings? Will this be helpful, or is it not necessary, or would you recommend this as a long-term follow-up?
No, I don't think it can hurt. Do you have a life coach? They're life coaches.
I know of life coaches
Yeah.
that I talk to. But yeah.
Or I think that that can be helpful. But I think the key to all this is that you have to trust that individual. That is a huge thing for me, that trust. When we talk about telling somebody your stuff,
Right.
You want to be able to trust them. And so I don't think that, I don't think it could hurt if she had somebody.
And let me
talking
just
to
say
an individual.
what is my saving grace. It has been my saving grace since my Graves' disease, is to be able to tell my story, to be able to look at the statistics of the people that we have helped in all walks of life. I get emotional because it's a relief. It's like, I know every time I tell my story, I'm helping somebody. I'm helping to pull somebody out of that box. I'm letting them know, go talk to somebody, go find help. Don't stop until you get the answers that you need. So every time I get the chance to do that, that's my blessing. That's what keeps me sane. That's what lets me know that everything happens for a reason. And if I had my whole life to live over again, I would ask for my Graves' disease. I would ask for it to be exactly like it is. Because I know what it means to be in a box and to fight your way out. I know what it means to always look to the finish line. Keep those blinders off, but understand that everything that I'm going through now, like I said, I wanted to be a teacher. And as I look at my life right now, I am a teacher. I just have a bigger classroom.
Great, great, great. Fantastic. Gail, I'm deeply impressed. Deeply impressed.
Well,
all the best to you.
Thank you.
All
I'm so
the
glad
best
to
you.
have been here, so glad that we were able to do this. And this needs to be, like you said, on a regular. Let's do some Zoom meetings and help some people, and let them know it is okay. it's okay.
All the
to
best
be
to
okay.
you.
Thank
All
you.
the best. Thank you so much, Mrs. Bum. Thank you so much.
for allowing me to be a part of
Thank
this.
you.